Hi ladies, so today I want us to talk about this suppository called klovinal. I know you might want to know how to use it and when best to use it and also what it's all about. So on today's video I'm to guide you on that. So this is a VG pastry that contains metronidazole, clotrimazole alongside with lactobacillus spores. So now let's talk about the use of metronidazole in this combination. It is used to treat any form of bacterial infections in the vagin. For example, bacterial vaginosis and Trichomonas vaginalis. While clotrimazole is used to treat any form of fungal or yeast infection of the vagin. For example, vulvovaginal candidiasis, also known as toilet infection. So moving forward to lactobacillus spores, it helps to keep the vagin healthy, and also it maintains the pH of the VG by producing lactic acid, hydrogen peroxide, and other substances that inhibit the growth of yeast and unwanted organisms in the VG. This is the reason why you don't need to wash your VG with any form of detergent, because it's going to alter the pH of your VG, which is not nice for you. Because when your pH is being altered, you will be of high risk of getting infection. So that's why it's advisable for you to wash your VG, for you to wash the outer part of your VG with ordinary clean water. No form of detergent should be used to wash your VG to avoid unnecessary infections. So moving forward to when to make use of this medication, you don't just go to a store, buy it because you saw your friend making use of it. You say, okay, fine, let me also insert because why? I'm a lady, or because I feel that maybe something is there, but I'm not sure of it. Let me just insert. No, it's not done that way. Before you insert this medication, you should be sure that either the pH of your VG has been altered, which now resulted to you having either fungal infections or bacterial infections, or is being prescribed to you by your doctor or a physician, anyone that is well rooted in this medical line. So moving forward to how to make use of this medication, like how do you insert? Because this very one you don't swallow, you insert it inside your VG. So how do you do that? When you open this medication, you will see that it contains six pastries. Yes, it's six. It's not a tablet. It's called a pastries. So it contains six pastries, and each of them you are going to insert each night for 6 consecutive nights. How do you pull it off? So when you detach one of it from the rest, you will see an opening. There is an opening. You just open it from there. But before you do this, make sure you've washed your hand. Like wash your hand first with detergent. You rinse with clean water. Make sure your hand is free from any form of detergent before you insert this. And it should be the last thing you do before you go to bed. If you're the type of person that once you come back from work, you have your bath before doing other chores, it's fine. But before you insert this at night, like it should be the last thing you do before going to bed. Wash your hand thoroughly, open it, then use your hand to put it inside. Then use the middle finger to push it and make sure you push it to the extreme so that it will not fall off. Okay, so when you push it in, you weigh yourself. If you're feeling any form of discomfort, that means you did not push it very well. Push it, make sure that it's in the right position. Then when you're done doing that, you go to bed. You can put on a pint liner if you don't want your pint to stain, because it's going to dissolve in there and will discharge through the opening of the VG. So the next day you're going to wash up the surface of the VG and not the inside. The surface, just the outer part of it. Then at night, you repeat the process of inserting clovina inside your VG, just like you did it the first night. It should be the last thing you do before you go to bed, with your hands very clean. So by the time you are done doing this, you realize that every form of unpleasant smell or discharges you've been seeing in and around your VG must have come to an end. So thanks for watching, and do well to follow my page for more updates.